Rama.
Yes, yes, yes.
Good evening, everyone. I thank Dr. Sanjay Karla and Dr. Krishnan for giving me this opportunity to with you all. It's a break from the routine things. I will be talking about laughter and hygiene. Dr. Ram Mohan already explained the role. And if you see this, everybody is scared of cough and cold nowadays. This is from a serial called as Seinfeld, and my favorite is Kramer. And everybody is washing hands, everybody is scared, and everybody is doing so many things. We were all stressed out, and many of the people don't realize that we need to wash hands even before COVID. We should be clean even before COVID. Now only they are washing hands. That's why they are facing problems. As doctors, we used to wash hands even before that. Okay, this was an article published by Sir Sanjay Karla Sir, me and Ram Mohan and Vijay Kumar. This explains the laughter therapy in diabetes. Thank you, sir. And these are my colleagues and my collaborators and supporters. All are laughing. I got this picture. I asked them we should laugh, then only we'll do that. Okay. And Dr. Mahadevan sir told me that today is International Jokes Day also. So let us start with a joke. And the best joke in the world, two hunters are out in woods when one of them collapses. He doesn't seem to be breathing and his eyes are glazed. The other guy whips out his phone and calls the emergency services. He gasps, "My friend is dead. What can I do?" The operator says, "Calm down. I can help. First, let us make sure he's dead." There is a silence. Then a gunshot is heard back on the phone, and the guy says, "Okay, now what?" So you have to be very careful when you go for hunting with your friends. This is the best joke they say that in the internet. Okay, hygiene. Hygiene is very difficult to spell. I was very careful to spell check because spelling is very confusing, very difficult to pronounce also, and it varies from people to people. So hygiene for someone is different from hygiene. We used to have a friend in our MBBS days. So he and my friend went to buy some undergarments, and my friend bought seven, and he says it's for Sunday, Monday, Tuesday, Wednesday. And this G, he bought 12, and my friend got surprised. "That's wonderful. You're so hygienic. How you do that?" He said, "It's easy. January, February, March, April, May, June, July, August, September." So it varies from person to person. So these are the things. And another thing is this Mr. G, he went abroad, and at that time AIDS was prevalent, and someone came and showed a syringe. This is containing serum with HIV patient serum. If I inject, you will get HIV. Otherwise, you give me your purse, I will leave you. This fellow said, "No problem, you inject." Then that fellow injected, and everyone surprised, "Why you did like that?" He said, "I follow my doctor's advice. I am wearing a condom." So hygiene varies from person to person. Okay. Then kids will be already explained. Mothers are our first hygienists in our life. And one kid came to my home, and my mother told him, "I can tell you what you ate yesterday." Then he asked, "What did I eat?" She told, "You ate pizza," because food is on his mouth. And he said, "No, auntie, I ate it day before yesterday." So it varies from, hygiene varies from person to person, but hygiene is very important. So this is we were using, and every one of us became alcoholic due to COVID. Previously alcohol. Now I use so much alcohol-based sanitizer. My hands had to join 12-step program. So much alcohol we are consuming. And this is hygiene varies from person to person. And he says, "I received a complaint from your computer. You hadn't been washing your hands after the use of restrooms." So computers are so sensitive. Then and this and this is how people stay with germs and other things. They live with them. There are billions of germs, bacteria and microbes living on my body, but I still get lonely sometimes. So hygiene varies from person to person. And this is the interesting thing. Facebook friends are better than real friends. Nobody on Facebook had bad breath. So when we have bad breath or bad odor, we should take care, because this personal hygiene is very important. Okay, Sarah asked me to talk about mental hygiene. developing, maintaining, and promoting necessary behavioral, emotional, and social skills to sustain good, effective, and efficient mental health. So, hygiene is not only physical, but we have to do mental hygiene also. Hygiene is austerity. I found out that austerity means tapas. So it was seen in Bhagavad Gita. So in 1714, worship the supreme lord, the Brahmins, spiritual master, the Vaids and elders. When cleanliness, so even Krishna says cleanliness is important. So we should remember that cleanliness is very important, and it was seen in our ancient texts like Bhagavad Gita. And about hygiene, how we talk, how about mouth, that is very important, because whatever we eat is not important. My friend used to say what we talk is important. So what he says is anugveda karam vakyam satyam priyahitam chaya swaja. So what he says is words do not cause distress, are truthful, inoffensive, and beneficial, as well as the regular recitation of Vedic scriptures. These are declared the austerity of speech. I feel that this is hygiene of speech. We should remember that. And again, thing is austerity of the mind, means that is the hygiene of mind, serenity of thought, gentleness, silence, self-control, and purity of purpose. All these are declared as austerity of mind. So cleanliness, not only our body, but we have to clean our mind also. And laughter is the best medicine unless you have diarrhea. And some people call themselves verbal diarrhea, but hygiene is the best to prevent diarrhea. Okay, until you meet your patients and do these